Hello everyone, I am here with my follow-up video to my recent skin cancer story. I wanted to do a separate video on my recovery after the procedure and on the things that I've used and done to help with my scar healing and just overall minimizing that appearance of the scar. So first, I kind of mentioned in the last video that this was a bigger excision than even I was expecting. So I was a little surprised and I wasn't really as prepared afterwards as I should have been. I didn't take the next day off of work. So the next day I was doing my regular, 8 to 5 shift, and I still had a lot of swelling and pain from the incision that I was kind of dealing with all day. And I'll put some pictures up around this time to kind of show you what the incision looked with the stitches, and kind of you can even see some of the swelling, but it was quite swollen at the time. And the next day, by the end of the day, I was in quite a lot of pain. It was throbbing, it was hot, and as you can see in this picture, I've attached a cool ice pack to my forehead so I could finish notes before I went home. So the moral of that is, if you're getting a similar procedure, take the next day off if you can. There is some recovery time, it's not a lot. Really, the swelling went down in about 24 to 48 hours, but I would have probably been a lot happier having just taken an extra day to let myself recover at home and not be up on my feet and up and about all day long. So after that, I kind of want to discuss the just scar care with the stitches in place. So the dermatologist or plastic surgeon, whoever you see, will usually give you some instructions, and you would just want to follow those instructions. I think the main thing that helped me is, one, I was generous with the petroleum jelly, so they'll give you usually a sample of the petroleum jelly to use a couple times a day. And there often is a lot of buildup around the stitches themselves. There's some oozing from the wound, and that can start to cake onto the stitches. And so once it's a couple days in, just gentle cleaning of that, making sure that there's not extra pressure pushing on the wound and buildup that could be impeding healing. The stitches get taken out after about 7 to 10 days, and that's when I started using the products that I had been researching to help with scar healing. And I found that these worked really well for me. I'm not currently wearing any makeup on my forehead, so it's hard to tell sometimes in the video, and I'll be putting some pictures up of kind of before and after and what the scar looks like now, 6 months later after doing these things. So first thing I used when going back to work was these Silicone Gel Patches. I just happened to use the brand Scar Away. There's obviously different brands, but with going to work, being in the clinic and seeing patients all day, I didn't really want to have my scar just kind of open there on my forehead. I didn't want to give anybody a scare. So I used these patches for a couple weeks, maybe 2-3 weeks, and they were pretty nice. They stay pretty well. They are kind of a tan color. So obviously people know that there's something there. It's not any type of, translucent or, blends with your skin or makeup, but it looks more like a bandage. The nice thing about these sheets is that they are washable, so you can reuse them and alternate them, and I think they're good for about 7 uses each. So that was helpful in the first couple days. Now, once I stopped using the patches, I started using the silicone gel, and again, this is the same brand. I think this actually came as a package deal. It came with both of the gel and the patches. And this one tube has lasted me the 6 months. I still have a little bit left in here. I'm getting close to being finished with it. But this I apply twice a day, once in the morning before my makeup and once after washing my face at night before I go to bed. And I probably attribute a lot of my healing and the how well the scar's doing to the silicone gel. So this is definitely what you want to be on your recovery list. Now, the number one scar healing treatment or prevention of developing a lot of scar tissue and like darkness in your scar is sunscreen, sun protection of some sort. Literally the same day I had the procedure done, Rune and I went out and I bought myself a sun hat to start wearing when I'm out and about and outside and gardening or whatever else. And I was wearing sunscreen on my face every day for years. And it is also the best prevention for developing skin cancers. And you want to start at an early age for that. But this is a sunscreen that I've used pretty much since I had the procedure done. I used this before as well, but it's a good, pretty heavy duty sunscreen, but it goes really well under your makeup and blends nicely. They also make this in a tinted version, which I have and am out of. And honestly, I don't wear a lot of makeup right now because we're wearing masks all day at work anyways. So I pretty much just wear sunscreen, and if I have a tinted sunscreen, that might be all I wear, with a little bit of translucent powder. And right now, since I don't have a tinted sunscreen, I'm wearing just a thin layer of this Bare Minerals tinted moisturizing cream that also has SPF. But the sun protection and the silicone gel, I think, have been the most helpful. And this doesn't have to be for a brand new scar either. The silicone gel can be helpful for scars that are years old. And so definitely if you have scarring, if you have concerns, obviously these products could be helpful. But also talk with your dermatologist. There are other procedures that they can do to help minimize the appearance of scars, because it can be hard to be wearing a scar, especially somewhere that's prominent that everybody sees. And you know, it's part of a self-esteem issue. So I wanted to share these things because I found them very helpful, and I think that they've worked quite well for me. Again, I'll kind of put some before and after of what the scar looks like now, about 6 months out. And if you have any other questions or thoughts, please let me know. But I hope this is helpful to somebody out there, and I hope you have a great rest of your day. See you next time.